In this video, Medicare Informatics would like to share information about the 2021 and 2022 ICD-10-CM HCC changes, newly added, deleted, or revised CMS HCC ICD-10-CM codes for risk adjustment. 205 codes were added to the 2022 ICD-10-CM code set, effective October 1, 2021. Among them the following ICD-10-CM codes are included: new, deleted or revised CMS HCC ICD-10-CM codes for risk adjustment. C563 malignant neoplasm of bilateral ovaries. C7963 secondary malignant neoplasm of bilateral ovaries. C847A anaplastic large cell lymphoma, ALK negative, breast. D5521 anemia due to pyruvate kinase deficiency. D5529 anemia due to other disorders of glycolytic enzymes. D8944 hereditary alpha tryptosemia. E75244 Niemann-Pick disease type A/B. G0482 acute flaccid myelitis. M311 is converted to parent code and it is further specified as the following three new codes. M3110 thrombotic microangiopathy, unspecified. M3111 hematopoietic stem cell transplantation associated thrombotic microangiopathy. M3119 other thrombotic microangiopathy. Thrombotic microangiopathies are rare, yet life-threatening, disorders that encompass microangiopathic hemolytic anemia, thrombocytopenia, and microthrombi, which, in turn, leads to ischemic tissue injuries. These conditions require urgent treatment. Sjogren syndrome codes were expanded with the addition of 7 new codes to describe involvement such as inflammatory arthritis, peripheral nervous system, central nervous system, gastrointestinal, glomerular disease, vasculitis, and dental involvement, M3505 M350C. The titles of subcategory M350 and codes M3500 M3503 were revised from Sika syndrome to Sjogren syndrome. 9 codes are being added to cover non-radiographic axial spondyloarthritis by site, M45A1 M45OB, an expansion of low back pain into codes M5450, unspecified, and M5441, vertebrogenic low back pain. M45A0 replaces the M459, ankylosing spondylitis of unspecified sites in spine. M45A1 replaces the M451, ankylosing spondylitis of occipito-atlantoaxial region. M45A2 replaces the M452, ankylosing spondylitis of cervical region. M45A3 replaces the M453, ankylosing spondylitis of cervicothoracic region. M45A4 replaces the M454, ankylosing spondylitis of thoracic region. M45A5 replaces the M455, ankylosing spondylitis of thoracolumbar region. M45A6 replaces the M456, ankylosing spondylitis lumbar region. M45A7 replaces the M457, ankylosing spondylitis of lumbosacral region. M45A8 replaces the M458, ankylosing spondylitis sacral and sacrococcygeal region. M45AB replaces the M450, ankylosing spondylitis of multiple sites in spine. R4588 replaces the following previously assigned codes. R4589, other symptoms and signs involving emotional state. S06A0XA replaces the following previously assigned codes. S06890A, in Crown and J without loss of consciousness, in it and ter. S06899A, in Crown and JW loss of consciousness of unsp duration, in it. S06A0XS replaces the following previously assigned codes. S06890D, in Crown and J without loss of consciousness, subcenter. S06899S, in Crown and JW LOC of unsp duration, sequela. S06A1XA replaces the following previously assigned codes. S06890A, in Crown and J without loss of consciousness, in it and ter. S06899A, in Crown and JW loss of consciousness of unsp duration, in it. S06A1XS replaces the following previously assigned codes. S06890D, in Crown and J without loss of consciousness, subcenter. S06899S, in Crown and J WLOC of unsp duration, sequela. T40712A replaces the following previously assigned ICD-10 code. T407X2A, poisoning by cannabis, derivatives, self-harm, init. T40712S replaces the following previously assigned code. T407X2S, poisoning by cannabis, derivatives, self-harm, sequela. T40722A replaces the following previously assigned code. T407X2A, poisoning by cannabis, derivatives, self-harm, init. T40722S replaces the following previously assigned code. T407X2S, poisoning by cannabis, derivatives, self-harm, sequela. Delete the following codes from the poisoning by other synthetic narcotics code list. T404X1A, poisoning by other synthetic narcotics, accidental, unintentional, initial encounter. T404X2A, poisoning by other synthetic narcotics, intentional self-harm, initial encounter. T404X3A, poisoning by other synthetic narcotics, assault, initial encounter. T404X4A, poisoning by other synthetic narcotics, undetermined, initial encounter. T86842 is a nonspecific and non-billable diagnosis code. Consider using a code with a higher level of specificity for a diagnosis of corneal transplant infection. F32A, F78A1, F78A9, and G4486 are new 2022 ICD-10-CM codes that became effective on October 1, 2021. K228 has been converted to parent code and it is non-billable and non-specific code. Please use K2289, other specified disease of esophagus. Please contact us if you would like to implement the risk adjustment score calculation solutions in your environment. Thank you for listening.